Hello, Mr. Fernandez. How you doing today?
Good.
All right, that's good. I'm Dwayne Steele, and I'm going to be your student physical therapist for today. And today I'm going to be working on compression bandaging on you. Before we get started, I'm going to go ahead and wash my hands. Do I have permission to touch? Yes? Okay, good. Well, what I want to work on is to continue maintaining the effects of the MLD treatment that you recently had. Just want to work on increasing the tissue temperature and the shape and size of the limb, and to decrease the swelling that you had from the MLD treatment that they had. We're going to work on increasing pressure in lymph vessels, increase the venous and lymph return back to your heart. We're also going to work on increasing the muscle and the joint pump action so that we can get that flow going, increase that circulation, and decrease the swelling that occurred, okay? Before we get started, I want to make sure there's not anything that will impede me from doing this actual treatment. So I just want to ask you a few questions. Do you know if you have heart or lung disease? Any recent dislocations or fractures that I may need to know about? Are you known to clot? No? All right. What about any sensation problems? Do you have problems feeling anything? No? All right. Before we get started, I'm going to go ahead and just inspect your skin just to make sure I don't see any open wounds or any infections that you say you don't have. Just want to double check. And I want to check your sensation. If you can go ahead and close your eyes and turn to the right for me. Just let me know if you feel the touch. Just say it by saying yes. All right. Good job. I'm going to go ahead and get started. Just applying the bandage. And we're going 2 centimeters from the axilla. All right. You can go ahead and just relax for a minute. I'm just going distal to proximal. And to that. You can go ahead and make a fist for me. All right. Put your palm down. All right. Perfect. You can go ahead and put your thumb through for me. All right. Just want to make sure. Now what I'm going to do is start applying the foam. Give me a fist for me. There we go. You can go ahead and bend your arm for me. All right. sure. Looks like we have an even length, okay? I'm going to go ahead and start applying my bandage. I'm going to apply a 50% stretch. Start going around. Put your hands for me. That thumb area. Give me a fist for me. Alright. And what you want to do is you want to wear this daily. And when showering, you want to make sure you cover it up with a plastic or a garbage bag, just not to, harm the garment. You can wash it in warm water. About 86 degrees, 86 to 104 degrees, with gentle soap, and you can air dry it. Can you bend your arm for me? All right. And then I'm going to go in the opposite direction. You also want to perform daily skin inspections. Just make sure you don't see any abnormal colors or changes that are happening. If so, you definitely want to call your physician, or you can call myself. You want to make sure the garment is well fitted, snugly like. And wear gloves when doing anything with your hands, such as washing the dishes or gardening. All right. And so you want to also, can you make a fist for me? All right. Bend your arm for me. All right. Go ahead and relax. All right, so just some other things that you want to work on is you don't want to lift any heavy objects. I know you have a kid. You may want to, slow down on the lifting of the kid. I know they like to be held and everything, but you want to slow down on that. I mentioned to you about the gloves. You want to make sure you protect those hands at all costs. And use acidic lotion at least 2 times a day. Eucerin lotion, the product is by Eucerin. That's a very good product, so you don't have to worry about anything like that. Trying to figure out what kind of acidic lotion to use. That's a good product for you. You also want to avoid any trauma to the skin, such as scratches or punctures, anything from which sharp objects. You want to remain from, encountering those kind of things. You also want to, when you go to the doctor, if they want to check your blood pressure, just tell them, can you use my right arm instead of my left arm? You want to avoid any punctures to that left side, such as needles or anything. If you have to get a shot or anything, try to get it on the right side. Do you have any questions or concerns for me? No? None? All right. Well, thank you for having me.
Thank you.
Thank you.